My name is Eric Tene and I am here to do an NG tube insertion on my patient. Before I start the procedure, I will verify the physician's order to be sure that I'm doing the right procedure and on the right patient. Uh, I will now get to the patient's room, knock at the door and get in and introduce myself to the patient and also ask the patient to tell me his name and his date of birth. I will confirm his identity by looking at his wristband. Having done this, I will now provide for privacy, don my gloves, and assess the patient. I will assess the patient's mental status by asking him to either tell me the date of today or to tell me where he is or what he is sick of. After that short conversation with the patient to assess his mental status, I will continue with further assessing him by inspecting his abdomen. I will be inspecting for any distensions. I will be observing to see if there are masses, or I will also be finding out if there is any tenderness or if the patient is feeling pains anywhere. Having done that, I will further ask the patient if he has had any nasal surgeries lately. I will also inspect the patient's nostrils to see if they are patent. I might also want to find out if there are any lesions in there that might hurt him during the procedure. But given that everything is okay, I will proceed with the procedure. At this moment, I will want to position my patient. So I will take up my bed to waist level and make sure that the patient is properly placed in a high Fowler's position. Good. Being in a high Fowler's position, this minimizes any risk of a reflux action during the procedure. I will now treat my patient with a bath towel to make sure that if the procedure gets messy, it will be under control. Having done this, I will bring my material or equipment together and place an emission basin somewhere by the patient in case he needs to throw up. I will also place a pH strip so that I can find out to know if my tube has been inserted in the gastric region. Now I will proceed by measuring the tube to see how much of it will be inserted into the patient's gastric region. I will measure by starting from the tip of the nostrils right to the tip of the earlobe and then down to the xiphoid process somewhere here. And given that my tube is not calibrated, I will use a marker to mark the distance of the tube that will be inserted into the patient. Having done this, I will now lubricate the tip of my tube to make sure that it doesn't irritate too much during the insertion procedure. I will lubricate about 4 centimeters of the tube. Now, I will ask my patient to flex his head backward on the pillow so that the passage can be a little bit open. When he does that, I will insert the tube gently, inserting about 1 centimeter at a time. When I get down to the pharynx, I will ask the patient to tilt his head forward towards his chest so that the tube can have an easier way down. Then I will continue to insert 1 inch at a time. I might also have the patient drink some water, and when he is swallowing the water, that will facilitate the insertion process. So I insert my tube 1 inch at a time to when I get to the point that I marked before. Good. Now, the tube has been inserted right to the mark. I will now proceed to secure my tube in place. Take my tape. Having secured my tube in place, I will assess the procedure to be sure that my patient is not having any respiratory distress. Then I will proceed to inspect the placement of the tube. I will do this by assessing to find out if he has any respiratory distress, or by getting an aspirate from the stomach content to find out the pH level of it. I will aspirate a little bit of stomach content, put it on my pH strip, and verify my pH strip to be sure that the tube is well placed. If my pH strip reads between 0 to 4, I understand that the tube is placed rightfully in the stomach or in the gastric region. If the reading is above 4, that is, let's say from 6 upward, then I will know that I misplaced the tube, probably in the lungs. But to confirm further, I will ask my patient to have an X-ray. When the patient comes back from the X-ray and the placement of this tube is properly confirmed, I will now proceed by hooking my patient up to suction by clamping the tube once more, taking off the syringe and hooking up my tube to suction. If not, I will just clamp the tube and leave it in place for future use. I will now proceed to secure the tubing on the patient, on his gown. Then at this point, I will clear off the mess from the patient, take off the bath towel that was put on him, and reposition the patient in a position of comfort. Having made sure my patient is comfortably positioned, I will assess to find out how well he tolerated the procedure. If he has no pains, I will ask him to alert or signal me or call me using his call light if he wants me. That said, I will place the call light beside the patient before I leave. I will now take off my gloves and then document the procedure. Thank you.